Hello, this is Amanda reporting off night shift. I had Mrs. What is her name? Burns, I think. 73-year-old female in room 52. She had her total knee replacement on the 10th of this month. Her course of stay was complicated by increased pain post-op. The docs were called and came up and never really found anything, hematoma or anything like that. So they left her PCA a little bit longer, gave her another nerve block, and then ended up DCing it. And she's on PO pain meds now. Her stay was also complicated by she got that horrible upper respiratory infection that was going around from one of her visitors and ended up with a right lower lobe pneumonia. She's now got one more dose of antibiotics, IV, I think, and then she'll be done with that. And then she, I think because her defenses were down, ended up with a UTI and some urinary retention. So they actually did put in a Foley, and that's going to come out tomorrow. And then if she voids, then she can go to rehab. So she's pretty stable at this point. She has a past medical history of glaucoma and hyperthyroid. She had her gallbladder out and had a wrist fracture years ago. And otherwise, she's a pretty healthy 73-year-old. Neurologically, she's alert and oriented times 2 to 3. She can get a little bit confused after she takes pain medication. She is moving everything. Obviously, she's a little bit weaker in her right lower extremity. She doesn't complain of any numbness or tingling. For pain, she complains of most of the time, 7 out of 10 right knee aching and throbbing. After she has her one Vicodin, 500, it will go down to a 3 or 4, and she can work with PT, but then it comes right back to a 7. So that's been an ongoing issue, and she can have one of those every 6 hours. Skin-wise, she's still got a saline lock in her left forearm, number 20, that we're using for the antibiotics. Her right knee has steri strips, some bruising, and bruising, steri strips, that's about it. Various stages of bruising, of course, from the surgery. 9 days ago, it's getting pretty light. But then she likes to have an ACE wrap over it for comfort. So I've been putting Telfa so that the ACE wrap doesn't rub against the steri strips. And then we recommend taking that off at night because she really doesn't need anything on that. So cardiovascular, her vital signs have been stable. She's got a regular rate and rhythm. Her blood pressure's been around 140 over 80s. Her pulse is 85 to 95. And she can go over 100 if she gets anxious or she's in pain. She's got good pulses. She does have 1 plus edema in her left lower extremity and 2 plus edema in her right. And that's been stable since surgery. Respiratory-wise, she's getting over that upper respiratory infection, so she's got a productive cough. She's decreased in her right base where the pneumonia is resolving. She's got some scattered rhonchi throughout, and she needs to be doing her incentive spirometer. She's 94% on room air. She is a fall risk. She is impulsive and wants to, she was an independent lady, so she wants to just get up and do what she wants to do. So she's on fall precautions and her bed alarm is on. She's, as far as musculoskeletal, PT's been working with her. She is ambulating with toe touch weight bearing on the right with a walker and definitely needs standby assist with that. She's on a regular diet. She's not taking a ton in. She doesn't like the food. She's got positive bowel sounds, and her last BM was yesterday at noon. GU, she does have that Foley. and that's supposed to come out. There's an order to have it come out tomorrow morning. And then she'll obviously have 8 hours to void and then discharge after that. So it should come out like 5 or 6 a.m. Then psych, so she lives with her husband. They've been married forever. She's got kids and grandkids in the area, and the husband has an odd affect and can be demanding at times. So just give you a heads up on that. Discharge to rehab tomorrow. Medications, you can look at the medication sheet. She doesn't take much. At home, she's on Synthroid. I think that's it. She's a full code. And labs are looking pretty good. The most remarkable one is her white blood cell count, which is now down to 12 after it was up to 19 at one point. So everything's resolving. And she's in pretty good shape. So good luck with that. Have a good day.